Rehab with Dr. Drew is on the air. No celebrities this time around, but young adults who really need help with addiction issues.
We're taking the battle to the front lines of this terrible disease for the lives of everyday Americans.
This is like the worst.
Have you ever had a seizure?
Yeah. I think I'm like gonna have a panic attack or something.
Ashley's detox symptoms have the potential to be life-threatening. It's going to be intense as these days go forward.
And I will tell you, having seen the show, it's far more dramatic than that. And I promised you that I wouldn't interview you about you, but let me just start very quickly. In this, you sometimes cross a line that you keep, and that is you usually don't get in the faces of people.
Oh, I have to with this group a little bit.
You do,
yeah.
You do.
Why with this group?
Well, this group has really bad addiction, and they're in terrible withdrawal, and as a result, there's a lot of aggression and impulsivity that surfaces, and they can't behave in ways that endanger other patients, and that's when I get in their face.
That's when you get in their face, yes.
That's when I have to say, hey, you must stop or you are out of here. I'm going to give you one chance. You stop or that's it. I don't yell. I just am very, very firm. It to me sounds like yelling on TV.
You may not think you're yelling, but it plays like you're yelling.
And it's through a lot of yelling that's in the room, and I have to be heard. And it just, they cannot do that. And and several of them got very close to being discharged. One of them actually ends up in a locked psychiatric unit. I mean, this is a very group of people that really needs care. And for their Shelley, and that's Dion, who's doing fantastic now. They're all doing great right now, actually. You wouldn't believe from where they started, that's, we call them Drew or Drew B, how well they're doing now. It's remarkable.
What are their addictions?
And heroin, alcohol, benzodiazepines for the most part. But I'll tell you what, the one thing I want to do is tip the hat a little bit to VH1, because this group has needed a lot of aftercare. We've been treating them intensively for 6 months, and VH1 has footed that bill. Anything I've asked for, they have delivered.
And they understand there's a responsibility beyond the good show.
That's right. Okay. And they tip of the hat to them for really.
I want to ask you about the issue of marijuana, because it's a legal issue now. You see it's in the news all the time. We also see the demographics will eventually drive it to a point where it will be legal, and people of a different generation think of it as the alcohol of today.
Yeah.
Is there a warning sign in this for you?
Well, there's a couple things. I mean, I don't have a strong position on this, just Steve. I really don't. I mean, the way the laws govern drug use and all, to me, is almost bizarre and draconian. We don't really think about them.
There's no logic.
There's no logic to it. It's all based on a Harrison Narcotic Act from the turn of the century.
A past cultural position.
Yeah, and so and when things are illegal, sometimes it does help me get somebody to stop when they can't stop. There are consequences that come down, but I still don't have a strong position about it. There are some issues that are above and beyond alcohol that you need to be aware of. Start using in adolescence, it can affect your IQ for a lifetime. That has now been
that
shown.
just came out recently.
Yes. Twice the risk of testicular cancer. I thought about it when that came out. These are 3 studies that showed this.
Really?
And I thought, every case of testicular cancer, I treat a lot of addicts, to be fair, but every testicle cancer I've seen has been a bad one, and it's been pot smokers. So.
And do you see it with more occurrence than you would see in the general population?
The testicular cancer?
Yes.
Well, that's what they're saying, twice the risk.
Yeah. Do you see it in your own?
Do I see more?
Just anecdotally, do you see it more testicular cancer than you would think you would see?
No, I see about what I would say.
Okay,
yeah. So I'm an internist, so I treat a lot of cancer.
Okay,
and stuff, so.
okay.
But and pot, the thing with pot is it's not addictive for everybody, but for those people for whom it is, it's really hard to stop. I mean, it is really hard.
Do you go through withdrawals?
Yes, you
marijuana?
do. If you're smoking enough, you do. And the withdrawal is irritability, agitation, sleeplessness for up to 6 months, mood disturbances, and a distinct kind of paranoia. They get very irritable and
so you have
treatable.
You have kids.
Yes.
What do you say to your kids?
Here's what I say to them. I sat them down when they were 14 or 15. I remember this very distinctly at the breakfast table I think we were at. And I just said, look, they'd all seen my drug unit. I exposed them to what I do there. And I said, you guys know what I do for a living. I see young people, parents, not doing what they need to do. I tell them what to do, they don't do it. So I want you to understand, it's going to kill me, but here's what's going to happen if you guys do drugs.
What?
I'm going to make sure you get arrested, and I'm going to make sure the full brunt of the law is brought down immediately, and you're on your own. You're on your own. I'm going to make sure the judge forces treatment in some way. I'll help with that. But I'll make sure you get arrested. If you're on drugs and you're driving, I will call and I'll give the driver's license. I will make sure you are arrested. If you go to a party where parents are administering alcohol and you're underage, I will show up with the sheriffs and I will have everyone hold off and I will be laughing my butt off on the front lawn.
Will you be okay when your kids are 25 and they're smoking marijuana?
It's on them then.
Would you
I've
be okay
done my
personally,
job.
though?
It's on them. I know I would be concerned about them, but I wouldn't.
It's medicinal?
It's well, the medicinal thing. That's a whole other topic.
Just checking.
Yeah, I mean, every patient I treat has a marijuana prescription. Every drug addict I treat has a marijuana prescription.
Right, you can get them on the street.
What does that tell you about the screening procedures there? I'm just.
All right, Rehab with Dr. Drew. It airs Sunday night at 8 o'clock on VH1.
No celebrities.
No,
I
so
like that.
real people.
Jennifer Jimenez.
Yes.
You've helped her, and she's helping you on
Yes,
this.
indeed.
Okay.
She's a good resource for us.
Drew, thank you.
Steve,
Good to
appreciate
see you.